All right, good afternoon and welcome to our 10th virtual town hall devoted to 2020 planning activities here at Johns Hopkins University. I'm Stephen Gange, Professor of Epidemiology and Executive Vice Provost for Academic Affairs and one of the leads in our 2020 planning efforts. I'm delighted to be moderating this session with four of our distinguished university leaders: Heidi Conway, Vice President for Human Resources; Andrew Douglas, Professor and Vice Provost for Faculty Affairs; Jon Links, Professor, Vice Provost, and Chief Risk and Compliance Officer; and Bob McLean, Vice President for Facilities and Real Estate. Last Friday, we announced that we are planning to stay in phase 1 of our reopening plan, which means campus activities will be restricted to those that are critical for our mission. For those who will need to be in our buildings and on our campus in the coming months, we have posted a revised version of our return to campus guidance that is the topic of today's town hall session. It updates and expands our June 2020 guidelines with important information about health and safety, campus operations, and support and resources for our community. Importantly, this fall, most Johns Hopkins affiliates will not be on campus on a full-time basis, and much of our work and services will continue to be done virtually. The guidance that we've put forward is for the mission-critical activities that will be occurring on campus. If you are a researcher, activities that require access to campus will continue to be permitted as per the Return to Research guidelines. All undergraduate and most graduate instruction will remain in an online remote modality, but schools may ask faculty and TAs to use campus studios for remote instructional purposes. These will be sanitized and set up with measures to protect users as described in this document and in our instructional guidelines. Our wonderful libraries will be operational, but access will be significantly limited. Most other campus facilities, including recreational centers, will remain closed. If you're one of the Johns Hopkins affiliates who will be on campus, you need to be aware of the following requirements that are detailed in the guidance and will be discussed more today. You must complete a daily health check using an app called ProDensity. You must continue to use appropriate face coverings and adhere to other safe health and safety guidance, including physical distancing. You may not smoke or vape while on campus. By December, you must receive an influenza vaccination or receive an exemption. And for the limited number of undergraduate residential students, you must be tested for COVID upon arrival and participate in testing on an ongoing basis throughout the semester. The guidance that we've put forward was crafted foremost with the health and safety of our students, faculty, staff, and neighbors in the broader Baltimore community foremost in mind. They were influenced by our extensive consultation with our University Pandemic Academic Advisory Committee, our Student Advisory Committee, and our Health Advisory Group that included a wide range of topics, concerns, and alternatives. In our announcement for today's town hall, we asked you to send us questions beforehand and have appreciated the many that we've received. Below this screen is also a box that will allow you to send in questions in real time. We will answer as many of these questions as we can. Like our other sessions, this town hall is being recorded and will be available for asynchronous viewing. We will also use the questions that we've received to expand our FAQ documents on the website. So let's get started. Heidi Conway and Andrew Douglas co-chair our faculty staff return to campus work group. And I'll first turn to Andrew to talk about issues related to faculty. Andrew?
Thank you, Stephen. Good afternoon, everyone. Let me add my welcome to everyone on this town hall. Of course, particular welcome to faculty members from across the university. I just want to really say that university leadership understands that this is a particularly stressful time for faculty and staff, Let me focus on faculty members, even though faculty members themselves have advocated strongly for the needs of staff. To be blunt, there's just no easy solution to childcare, to the absence of in-person scholarly community, and to the disruption that has severely affected some, while, to be honest, some others have been able to continue in highly productive ways. Heidi Conway will follow me with a lot of specific actions taken with respect to caregiving. So let Heidi follow up with that in a moment. We know that we have to be pragmatic, we have to be innovative, and we have to be respectful of each other. And we're trying to find solutions that reflect Johns Hopkins' commitment to equity, respect, and the protection of all in our community. And as Stephen said, one of the reflections of that is the seriousness with which we took the advice from UPAC, our health advisory group, and our student advisory group. So we've heard from faculty members, particularly those with small children, whether junior or senior, that they are stressed and frankly exhausted, and fall 2020 has not even begun. Teaching is more stressful, research is difficult to conduct, research teams need more mentoring, more support, and more guidance. And President Daniels and Provost Kumar and the deans have conducted listening tours with junior faculty members in each division. And we are working on the challenges identified in those sessions. The report of these sessions, which was authored by Bloomberg School of Public Health professors Lainey Rutko and Kate Smith, can be found on the Hopkins Coronavirus Information website. So what do faculty members need to know for fall 2020? As Stephen has pointed out, it's actually not too difficult. Research is unchanged. So whatever you're doing now, please continue to do it in as safe a way as possible. There will be very few graduate courses that are taught in person, but all other teaching will be done online. Now, even though it's online, in most cases, it's not going to be the same as spring 2020. A number of schools across the university have invested heavily in infrastructure with which to make it a very different experience for our students. So there are studios and labs from which faculty will be teaching. There's a lot of training that's been done, and I want to thank the faculty for doing all of this training and for the teaching that is so different, and adjusting your pedagogy to what we hope is a materially different experience for the students from spring 2020. So in many schools, faculty are expected to teach from studios or laboratories unless an ADA accommodation or an HR adjustment has been approved. Faculty members should have a compelling reason to return to campus. So low density and spacing is not sufficient. We really do want to keep faculty and staff at home if at all possible. But we do want the critical functions of the university, research and teaching, to continue. So if you're teaching from a studio or lab, faculty members will need to be on campus. And of course, for research, faculty members will have to arrange how their research groups conduct their research. So with that, let me turn it over to Heidi, who will have more information, particularly on the care side of things.
Sure. Thank you so much, Andrew, and welcome everybody to the town hall. And before I get started, I want to express my deep gratitude to each and every one of you for your continued hard work and support during the COVID-19 pandemic. While many of our faculty and staff who are clinical facing and supporting our teaching and research have returned to work, we've asked many, if not most of you, to continue working from home through the end of the calendar year. And as we continue to work from home and with school systems closing, we have been focused on our childcare resources in support of our faculty and staff. We absolutely understand that this has been a great source of stress and anxiety for parents. And we're focused on supporting families. The complexity is daunting, in terms of how to support families. And I just want to mention a few of the challenges that are impacting our families to give you a sense of the breadth and the complexity. First of all, the types of need from the school-aged children to educational support, elder care support. Many families now with children in primary school who are now at home trying to learn online, and other support for children with special needs. The cost of care is daunting. And we're working hard to look at different options to bring additional support to our families. Exposure tolerance, you may have had a childcare arrangement that worked pre-pandemic, but now you're not comfortable with. And so that can be a real challenge. And then just general resources and also location of care. Many families had care close to work or some close to home. And now with people working from home, that's really caused some challenges. So we know that this is, as I said, causing a tremendous amount of anxiety and concern. The team, the HR team, along with many leaders across the institution, along with Lainey Rutkow and the Child Care Working Group and the Junior Faculty Group, have been focused on our existing child care program, which is quite robust. And in the conversations that we've had, we've recognized not everybody is aware of the resources we have, but we've also noticed or noted that there are places where we wanted to immediately focus and expand. And we're continuing to look at that. So I want to mention a few of the resources, but I also want to direct you to some of the resources available on the website, the HR website. So there's an HR website with the Covet section. It's www.jhu.hr.com or .edu, sorry. And you can look right under the benefits and work life section. And we have a section devoted to family caregiving resources. But let me mention a few of these that are existing, but we also expanded. Our care.com resources, care.com, we have an institutional wide for JHU and JHM resource for all things care. And this could be tutoring care, this could be babysitting, this could be emergency backup care. We have a subsidy that we provide around emergency backup care for certain salary levels. There are other ways to search for just general support for your home, cleaning, dog walking, things like that. We expanded this about a month ago, and it's available to all of our faculty and staff, and as well as students. Comet is a new addition to our family caregiving program. Comet is an application where we heard a lot from our conversations that parents wanted to partner and share in caregiving, given some of the challenges around cost. So Comet is an app where you can kind of form your own family and friend, what we're calling network or bubble, where you know those families are partnering with you and have the same kind of exposure tolerance and risk levels. And so Comet is an app where you can connect and share care, offer to babysit for one of your partners in the program, or seek care for your children. So it's kind of like this swap care pod or bubble, which hopefully many of you have heard about by now in terms of all things COVID. We also have the Maryland Family Network, and that is a support in Maryland for all things caregiving, whether it's in-home or center-based care. And we're very focused, given the urgent and immediate nature of some of the financial cost burdens due to COVID and childcare. We have our existing childcare voucher program, which supports families for childcare. We're also looking to expand our emergency relief fund, which is specific support, financial support that we can give to families that is tax-free during this emergency, the pandemic emergency only. So we're looking to get an announcement out next week on additional financial support. We also are looking to expand partnerships for online educational and tutoring support for families. Many families are now faced with children at home trying to learn online and need more support for certain subject matters. That will also be part of our announcement next week. So those were the things I wanted to cover around childcare. Again, I urge you to either call the Benefits Service Center or to visit our website, and also look for a broadcast email next week announcing additional supports. Thank you, Stephen. I appreciate the opportunity, and I'm sending my very best wishes to our community as we navigate this.
Thank you. Thank you, Heidi. There was a question that came in earlier just about updates on other employment actions or other things that the university may be taking. Do you want to talk about that?
Sure, I'm happy to talk about that. You know, as Stephen said, we have since the beginning of the pandemic gotten a lot of questions about the possibility of furloughs and reductions in force or layoff. We certainly understand that this may be causing concern and anxiety due to kind of the uncertainty of the challenges that we face as an institution. Employment actions such as furloughs and reductions in force will, of course, be very thoughtful and based on the needs of the business. They will also be made at the divisional and departmental levels in partnership with human resources. I think I said this at the last town hall I attended. Our goal has been to continue salary and benefits continuity, but we also recognize that there are certain realities around how our business operations are changing. So we've been very intentional, and there have been employment actions that have been taken at the divisional and sometimes departmental level since the pandemic started. And I expect that we will continue to see that as we go forward.
Great, thank you. There is also a question that was just submitted that a couple had received the child care voucher but had used all of this before COVID happened. Is there anything that might be available for them?
Absolutely. And Stephen, that's one of the reasons we do have the child care voucher program. We are focused on the Caregiving Emergency Fund, which will provide potentially a monthly benefit for childcare expenses that are and educational types of expenses, maybe laptop, things of that nature, based on things that are a result of the pandemic. So look for that sometime next week. We're targeting early next week. I did want to mention, back to the previous question, that I overlooked kind of the focus on employment actions, and when employment actions happen, we are very focused on providing robust support during the transition time, which provides career support, provides severance, and also provides support around subsidized COBRA rates for healthcare, just to ensure continuity and a successful transition for those who may be impacted.
Great. Thank you, Heidi. barring additional questions that have come in, and I do remind everyone who is listening live, please feel free to put in any questions. What we were planning to do is use first Andrew and Heidi to talk about issues with regard to faculty, staff, and then move to Bob McLean to talk about facilities and health, safety, and environment, and then lastly to Jon to talk about issues around health. But we, as questions come in, we'll certainly have an opportunity to go back to those. And as I was speaking, a question, Heidi, did come in about the career support that you mentioned. Is that something that's free to employees? Heidi, you're on mute. So is the career support free to employees?
So the career transition support is free to employees, yes.
Yeah. Okay, great. All right. So why don't we turn to Bob McLean, who chairs our Facilities and Health, Safety, and Environment Work Group, to talk about issues regarding activities, facilities, as well as PPE. Bob.
Thank you, Steve. So good afternoon, and let me add to everyone my thanks for your questions and for participating today. I'd like to start by just kind of quickly reviewing some of what has been done since the last town hall, since we last talked. A couple of key focus areas, certainly cleaning. So we've trained our campus teams on appropriate safety and cleaning procedures. We've increased cleaning frequency to once daily for occupied spaces. And we've designated portions of our cleaning staff to be cleaning ambassadors to address high touch points multiple times a day. We've also worked with the divisions to establish distribution and resupply processes for cleaning products. And we've certainly expanded dramatically our distribution and resupply of hand sanitizing stations around the campuses. We've also made adjustments to our mechanical systems per the CDC recommendations and ASHRAE recommendations. So we've increased air exchanges by adjusting all of our set points, particularly adjusting controls at night and on weekends to continue airflow and increase air exchange. We've increased the minimum fresh air intake of our systems wherever possible. We've also done preventative maintenance and changed filters, and we've increased to a minimum of MERV 13, which is a filter categorization effectiveness rating, wherever possible. And in many cases, we are higher than MERV 13. And then we've also conducted extensive potable water flushing for those buildings that have been vacant or minimally used, just to make sure that we take care of those potable water systems. For those folks who have been on campus, you may have seen that we've put out a number of temporary signs providing advice and guidance for everything from restrooms to general health. Those signs have been, are in the process of being replaced with our permanent signs with our JH Needs You campaign. And so many of the buildings are done, but the rest will be done over the next week or two. And this has been hard, but I think as a community, we've adapted to the campus guidelines, and I believe we made good progress in terms of compliance within many of our facilities. I will note that an area that we've not done as well is the use of face coverings when outside, and this might be education and awareness as much as anything else. But as a reminder, face coverings are required for everyone indoors and outdoors, and we want to exercise good practices. We want to minimize chance encounters with somebody where we might be invading their personal space or the physical distancing that we've identified. We want to make sure that everybody, regardless of whether they're inside or outside on campus, feels safe and comfortable and protected. I will note that there are some protections or exceptions for those who work outside all day in the heat and humidity, but they should be wearing face coverings when engaging with others and within the physical distancing guidelines. So, one question came in that, can we use our own face coverings? And so we've addressed that, I hope, in the return to campus guidance, but the answer is yes. The university will provide face coverings for affiliates. For undergraduate students that are here in the Baltimore area, it will be part of the undergraduate health kit, along with thermometer and hand sanitizer. And I know that divisions are coordinating, providing face coverings separately for their faculty, staff, and graduate students that need to come on site. But if you do want to wear your own face covering, it should fit snugly but comfortably against the side of your face. It should be secured with either ties around the back of the head or ear loops. And it should cover not only the mouth, but the nose. The more we learn about the disease and the more that the health experts study it, the more we understand the importance of covering both the mouth and the nose. There was one change in the guidance that you should note and is very important. And I, in fact, at the last town hall talked about the variety of face coverings that are available, to include neck gaiters. However, due to recent studies and an attempt to align with Johns Hopkins Medicine, the following are no longer acceptable as face coverings. So we had talked before about face coverings with an exhalation valve. Those are still not allowable, but we are also adding to that neck gaiter coverings and bandanas. So we are asking that everybody uses the standard face coverings. Again, not non-medical types, if at all possible, to save those for the health system. And we are focusing on the use of reusable masks that allow you to wash and clean them on a regular basis. A few other items I think I should note from the Return to Campus Guide. One change you might notice is on restrooms. Before we had simply said exercise, good physical distancing. To facilitate that, in response to a lot of conversations and questions from faculty and researchers, we are limiting restroom capacity to 50% of the fixture count. So if there's 5 urinals and stalls, it'll be a capacity of 2. If there's 6, it'll be a capacity of 3. We will note that on all restroom doors. There's not a way to automatically notify folks of current capacity at this time. So we just expect people to exercise good judgment and caution when using restrooms. So we did make that change for this particular Return to Campus Guide. We've had a lot of questions about events. And so we do have a very short section on events. Quite frankly, we do not expect to have many, if any, events. But we're deemed essential. They are limited to 10 folks or whatever the room capacity might be or space capacity might be. But they need to go through a process of review and approval with health and safety and with either the school or departmental leadership. And I know that the student affairs are actively engaged with student leaders and the student population and are providing advice and guidance around limiting student social gatherings to 10 as well, or using the standard space guidance of about 45 square feet per person. That allows for some space for the individual, 6 feet between the individual, and some space for the second individual. So we've used 7.5-foot diameter or about 45 square feet per person as a good general planning guide. And we've used that for classrooms and some other general density capacity. So you might be in a space that you can say, great, I can have 10 people, but the reality of the room might only be able to fit 3 or 4. And so that advice I know is being sent out to everybody. We've also expanded our discussion about transportation. Previously, we had bus capacity limitations of 24 passengers on our buses. We've looked at that and we've reviewed it in practice. We have, on very rare exceptions, approached that density. But we felt that in the interest of safety and maintaining that physical distancing, we would drop that further down to 20. And so right now our physical capacity for buses is 20, and we have marked either seats or areas to stand on the bus. And then for those folks who use the Blue Jay shuttle system, either the daytime shuttles or the nighttime rides, we have limited those vans to 6 people and again have marked those seats. And we have special cleaning protocols, cleaning them daily, with a special disinfectant, and then cleaning them throughout the driver shift by the drivers. And what you should notice if you are a user of JH Transportation Services or even public transportation services, there is some passenger tips and guidance that we've included in the Return to Campus Guide. And it's tips about where to sit, stand, facing forward, keeping the windows open on the buses whenever the weather permits, and certainly guidance around washing your hands or sanitizing your hands following your ride. And so for those who, again, use either public transportation or use our services, I really recommend you looking at that appendix in the Return to Campus guide. The other thing that's in the guide, and it's not really a change, but we have so many questions about it, is we continue to limit access to our facilities. We are not closed, but we are open only for essential activities. And so that is those activities that Stephen has talked about, directly related to approved research and instructional support. And so we are very focused on where people need to come and use studios, access research material, and have worked very hard around all the protocols regarding cleaning, density, capacity, air exchange, particularly to support those type activities. Unfortunately, what that does mean, again, as we've noted, is that there's no general access for the library. There's no general access for generic study space on campus. The library is restricted to those designated activities related to research or instructional support. Unfortunately, that does mean that our recreational activities, both indoors and outdoors, remain closed. It does mean that we are limiting undergrad or not supporting undergraduate research at this time. So again, we are trying to support the ongoing research. We are working very hard to support the return of instruction, particularly around the new pedagogical and methodologies and technology, but activities remain very, very restricted. So with that, let me pause there, and Stephen, maybe you could make sure I've addressed many of the key questions.
Yep. So a couple of questions. Let me start with some. You'd mentioned the PPE, changes that are now in the guidance. The face coverings that we're recommending don't have to be 2-ply, 3-ply, but they can't be the very thin gaiter type coverings, correct?
That's correct, and so there are CDC recommendations around what to use, and we certainly recommend people complying with that. But right now, it is again it's important that we follow the recent studies and guidance. I know that there are discussions about some of the studies, but we are also very very conscious of trying to stay aligned with our brethren at Johns Hopkins Medicine, and they've made the determination that that's the best practice, and we've looked at that and agree with that, and so that was a change that we've made for this guide.
Yeah. There was a question about whether face coverings need to be used by those who are in a closed office.
Yeah, thank you for clarifying that, Stephen. That exemption remains that if you are inside, if you are in a closed office, you do not need to wear a face covering. We ask that you close your door. We ask that when you step outside into the corridors or use the restroom or any of the common space or walk into the shared office environment, that you do wear your face covering. And certainly we have a number of faculty that will be coming to campus to use the studios. And those studios are similar to a single office environment and specifically geared in terms of technology training to support being without a face covering for that specific period of time.
Someone else asked about other people coming onto campus, right? We do have an open campus. Could you just talk a little bit more about, the safety monitors and others, signage that will be around for that?
Yeah, so this is an area that some of us have been talking about. We are an open campus, and so that makes it challenging. Recognize that for those on the Homewood campus, in particular, San Martin Drive is a public road, which we need to understand. We did work with some advertising, and we had some signs up earlier. The weather took care of those signs, and so we are in the process of ordering and should have up, I hope this week, some very large scale aluminum signs to educate folks. We are working to expand the number of our health safety monitors and expand not only the numbers, but also their focus to address the outdoors greater. We are an open campus. We do embrace our broader community and welcome our neighbors. but we are looking to maintain the safety and comfort of everybody on campus. And so we have a lot of work to do through education and awareness and communication to have our community wear face coverings when outside.
There was a question about, actually one more PPE question. If someone has forgotten their mask, is there an opportunity for them to get one?
Sure, great question. So it's gonna change campus by campus and division by division. So I would offer that, you know, as an example, at the public health, most of the folks go through a very central door to get into the facility. And so that's an easy place to have some temporary, you know, some of the temporary masks that you can hand out and issue there. A little harder on a dispersed campus like Homewood, but we've worked with the divisions where they have folks in their departments that are supposed to have some temporary masks. We've also designated and talked about areas like if someone needs to join the library, there's a security station at the library. Wyman, there is a security station at Wyman. And so we are looking to make sure we have some of those cloth temporary masks that are available for distribution. I mean, you know, we do want to facilitate people doing what they need to do, but just in a safe way.
You'd mentioned the shuttle. Will there be any changes to the frequency that shuttles will be operating?
We've made very slight adjustments, but generally we continue to run the buses, and those are the big, wider or graphically enhanced buses where we are running those from 6 a.m. to midnight. Most days a little later start on Saturdays, and I think we gonna have to remember, I think we start at 10 or 11 on Sundays, so it's a shorter period. But you can go to the transportation website. So just put in Johns Hopkins University Transportation Services, and we continually update the transportation schedule. So what we have done is during the height of the COVID response, we saw very limited ridership. We kept the hours, but we reduced the frequency of our buses. As we saw some more people return with research, we increased the frequency of our ridership of our buses to make sure that we match the ridership. And we have maintained, we adjusted our kind of our night ride to just a day ride. We're back to a night ride. Those hours right now are slightly adjusted, but from 7 a.m. to 7 p.m. to 2 a.m. And we just modulate the number of vans we have available to match the demand. So very slight modifications, but generally we are trying to provide the same level of services. And we want to provide as safe and comfortable a ride as possible. And we welcome feedback, shuttles at jhu.edu.
Let's see, a couple of other questions before moving on. One is a follow-up to the question about a closed office space, right? There's a question, you know, do you have to wear a mask in a lab environment in which one is working alone in a small closed room that another individual might occupy later in the day after disinfecting? I think that's a good question given how.
Yeah, it's a great question. And the answer is you don't know who else might be coming in the lab. You don't know who has been there before, coming after necessarily. I'm sure some labs have very good protocols where they do know that, but you know, it's not a private office. It's not private space. And what we're trying to do is make sure that to the greatest extent possible, we prevent the spread and people not only keep people safe, but keep people very confident in the procedures that are ongoing. And so we don't want them to have to go into a space where they might have a different view or a different risk tolerance level than somebody else. It's not fair to them. And so we are maintaining that standard for research labs.
There was also a question as a follow-up just about use of campus more generally, right? You know, I mean, we purposefully don't have barriers up to prevent people from coming to use the green space and other areas. There's just an expectation that they follow the rules that we've
That's
established.
correct. The campus is not closed. We are not providing general access for folks that don't have a reason to be in a particular building, but we are not closing the outdoor space. We just ask that if people do want to enjoy the campus or transiting the campus, that they follow the guidelines, particularly around the common themes that I think you've heard from everybody regarding face coverings, physical distancing, and then just good hygiene around washing hands, sanitizing hands as soon as possible.
And then lastly, there was also a question about the fact that there will be some classes that are in person. And it's probably worth pointing out that we have a fair amount of standards by which we ask divisions to follow. We're asking them for justification, a pedagogic justification for any class that is being given in person, as well as consideration of protection for students. And I think the protections there are along the lines of the general ones that you've talked about, as well as the distancing measures that are in our instructional guidance.
Right, and we've worked with all the divisions. Some of them have people on their staff that did the work for other divisions, and we from the central university perspective, we help support and provide some guidance or support to them, but basically work through all the classrooms, setting up some standard. Each classroom is configured slightly different. It has a different shape, it has different furniture, and so we work to really individualize. What does the standard of 7.5 foot diameter, the 45 square feet per person, what does that mean in practice? And how does it mean in terms of door entrances and where the instructor might need to stand? We reduce capacity from anywhere to 20 to 40% of classroom capacity, original classroom capacity. We averaged about 25%. So it was a rather significant reduction in classroom capacity. We obviously are cleaning the classrooms daily. We've worked with the divisions to ensure that they have a supply of cleaning materials available for the instructor and the students, should they want to clean their area before or between or after classes.
And just to clarify, it's 7.5 feet around each person, right? Which would ensure at least 6 feet distance between. Just a couple other questions that have come in, I think that are good ones that are broadly applicable. One, are there designated areas where people who don't have a private office can take off their masks to eat or drink, particularly researchers who may be in a lab for a long period of time?
Sure. So again, we've worked with the divisions to develop the methodology by which they can set capacity limits on their common rooms. So obviously, if it's a nice day, going outside to eat or drink is a great suggestion. I think you'll see a lot of the CDC recommendations about being outside, and so that's always a terrific recommendation. But divisions are authorized to, based on their needs and where they have people, to open certain dining areas or common rooms. And we've talked to them about, again, the same density application. If you have 3 tables, instead of 4 chairs per table, you now have 1 chair per table, and those tables are spread out. And you limit capacity to account for those people who might be sitting there. And then if you have somebody at let's say a sink or a microwave. And so, what you might have been able to support 12 or 15 people before, maybe today you're only supporting 3 or 4 people. But there are accommodations in the Return to Campus Guide and in our protocols that do allow the use of common rooms for that purpose.
And one last question, Bob. How do off-campus sites receive signage?
So we have worked with our asset management team to provide signage to them, and that's certainly in all the properties that team manages. If somebody is in a lease space, they can certainly reach out to me. They can reach out to our real estate team, Jim Callahan, Ross Fisher, and we will help facilitate the provision of signage for them. And they can also order them through their division. So we have facilitated the ordering of signage for all the divisions. And so, for instance, if it's a public health school lease, they can reach out to the real estate team, or they can reach out to the public health team, and they can facilitate that order.
Great.
And
Thanks a
I
lot.
should mention that,
Go ahead.
most buildings that we've engaged with or talked to or observed are doing a good job of trying to protect their tenants. I will note and acknowledge that not every building does it exactly the same, and there will be some differences in how they manage their common space areas, but that these guidelines do apply to space that we manage and lease. And so within our tenant areas, we are expected to abide by these guidelines, and we certainly are available to facilitate, as I said, the signage support if needed, but also if you have concerns with how your landlord is managing the property that you've leased, certainly reach out to us, to our real estate, either the leasing team or the asset management team, and we will be happy to work with you and see what we can do to facilitate a higher comfort level with the standards that are being set.
Yeah, and actually that brings up a good point. If someone has particular concerns of something that they see related to health, safety, and environment, use of PPEs, what should they do?
Right. I can pull it up as we talk, but I might be a little distracted. But in the Return to Campus guide, there are phone numbers for the two principal offices for the Health and Safety Environment Group that can address any requirements from any division. And really, any division should call any one of those numbers, and they will support you. There's also kind of the compliance hotline, Speak to Us, where if people have concerns, they can report that anonymously, and it will be followed up. And you know, we certainly do want to be in an education and awareness mode, and kind of all in this together and work together as a community. We know some people are quicker to comply than others, and so we just want to be in a position to facilitate that process.
Great. Thanks a lot, Bob. Now I'm going to turn things over to Jon Links, and given the number of questions that have come up, partly as a transition to follow up on a comment that Bob, you made. Jon, could you address a very specific question about undergraduate research for this fall?
Sure. Hello, everyone. We are operating in a very low density posture. And that means we're telling you a lot of very unpopular things. And this is one example. So no undergraduates in labs right now. That's at either Homewood or in East Baltimore. Quite frankly, we do not want to be welcoming to undergrads right now. We love undergrads. We want to, in terms of their remote online instruction, take care of them as much as we possibly can, but we do not want undergrads on campus. Let me say it even more strongly. We don't want anyone on campus who doesn't have a compelling reason to be on campus. So we've opened up the research labs because it's impossible to do research in many cases anywhere else, but we still have very strong requirements in terms of low density. We're still operating at 400 square feet per person, except in specially approved cases where you can go down to 200 square feet per person. So that still means very low density in the labs. Masks, as you heard, hygiene measures, etc. No undergraduate instruction on campus. And for graduate instruction, it is only by approval from the provost's office. And as Stephen mentioned, we are reviewing both the pedagogic rationale, why it has to be an in-person graduate experience, as well as the safety measures. And there's a very high threshold. The same thing's true with the libraries. The libraries are not in general wide open. They are open to specific individuals who have the equivalent of lab research in a library. Private carrels and spaces in the libraries are not open. In general, offices are not open, even private offices. Just because you have a private office doesn't mean you get to come to campus and use your private office routinely, because it's more convenient than being at home. So we're taking a pretty harsh operating posture right now in terms of limiting the density of folk on campus at any one time. None of us feels good about that. We feel terrible about that. It's just that we'd feel even more terrible about the alternatives.
So, John, that's a good segue into the fact that since the beginning of the epidemic, members of our community have unfortunately become infected with COVID. And we've talked about some recent cases that have occurred off campus. Do you want to talk about that, and then plans for our sharing this more consistently with the community?
Sure. So we have been tracking COVID tests and COVID cases in students, staff, and faculty since the beginning of the pandemic. Putting aside all the clinical folk in the School of Medicine, the number of cases has been low on the university side. It's been so low that we haven't felt comfortable from a HIPAA perspective and from a FERPA perspective in students in sharing the cases or even the numbers school by school. There's so few that we run the risk of people being able to sort of put two and two together and potentially identify individual cases. Having said that, we know it's time entering into the fall to be able to, in a more public way, share at least aggregate numbers. So on Monday, we think, we will be launching a dashboard that will show total number of affiliates, students, staff, and faculty who are tested, and the number that tested positive. And we will be updating that dashboard on a daily basis. We'll also show, just in aggregate form, all the results from the beginning of the pandemic through this weekend, just so you know what our experience has been so far. I hope we never get to the situation where we have enough cases that we could show numbers school by school, because we would only be comfortable showing numbers school by school if there were enough cases school by school that we didn't risk identifiability. But if we get to that point, we'll go to that finer grain detail. It is highly unlikely that we would ever go building by building. And the fact of the matter is, a moment ago, I talked about striving for low density still. What I always call the 4 pillars of control, masking, distancing, hygiene, and room ventilation, remain our control measures. And so we're going to be very strict, in addition to low density per se, in enforcing the masking and distancing, making sure that both personal hygiene and building hygiene takes place, and then all the work we've done that Bob's talked about in the past around room ventilation, and that's throughout the university and all the campuses.
It's probably worth mentioning that the guidelines that are now out there talk in a little bit more detail than previously about what the reporting that occurs if someone is found to be positive. Do you want to just say a few words about that?
Yeah, and that also, I think, then segues into testing in general, which I'll talk about. So I've told you before that there's three main uses of testing: medical management, epidemiologic surveillance, and public health management, more mass testing. Let me talk about each of those in turn. So for medical management, we are strongly encouraging, because we can't outright require, we're strongly encouraging all students, staff, and faculty to go through the Johns Hopkins COVID call center. This is a single unified call center for all university and all health system affiliates. It's in a unified physical location, and both university and health system personnel staff this call center. And the call center does everything from soup to nuts. So you either have symptoms or you're worried that you were in contact with someone who is COVID positive. You call the call center. If appropriate, using a standardized algorithm, you will be referred to testing by us. You will get the results back. You will have a healthcare provider talk you through the results and what you should do. You will also be interviewed in terms of close Hopkins contacts, and then we will notify those close Hopkins contacts and tell them what to do. Your identity would not be released unless you consented to it. Your supervisor would only be told if, for example, you test positive and have to isolate, that you're off duty. Wouldn't mention COVID, wouldn't mention testing or anything like that, unless you're okay with it and in fact would like us to do so. Many staff, faculty, and students actually want us to talk to supervisors disclosing the COVID information as COVID information. But what it does mean is if you're in a lab or you're in one of the rare classroom in-person instruction situations this fall, and you hear about or suspect that somebody else in the lab or the classroom tested positive for COVID, and they're not there for 10 or 14 days, and you're worried about whether or not you were exposed. This is a situation where no news is good news. There will be this case investigation and notification of close contacts. If you're not notified, you weren't deemed to be a close contact. And I want to emphasize that between the masking, distancing, hygiene, and room ventilation, if all of us are faithfully following the guidance, none of us are close contacts with anyone else. And you could have someone with COVID in our midst, so to speak, and there should not be a meaningful transmission. That's the point of those control measures. That is particularly true in a relatively low prevalence setting. And COVID, which we obviously are taking incredibly seriously, is still a low prevalence setting, particularly in a population of asymptomatic persons. And so in addition to these 4 control measures, masking, distancing, hygiene, and ventilation, we're doing additional things that I want to talk about for a moment. So the first is daily health screening. So we have an app called Pro Density. It is live now. You download the app from the App Store. It's unambiguous. There aren't a million different apps named Pro Density. And you log in with your JED credentials, and then it's a simple 2-question health screen. It is the same one that the health system uses. And if you pass the health screen, you get a green pass that is good for 12 hours. It resets every 12 hours. If you do not have a mobile device that can handle the app, there is an online version also tied to your JED login, and that's covidsurvey.jh.edu, covidsurvey.jh.edu. And so we will be tracking the daily health screenings of those who are on campus. We are not requiring folks who do not come to campus to do the daily health screening, but we are requiring everyone who does come to campus to do the daily health screening. And again, it resets every 12 hours. Most of us are going to use the mobile app to do it. And that way you can flash your green pass at a safety ambassador or a security guard when they ask to see it. I want to assure you that this mobile app is not collecting any information about you beyond the answers to those two health screening questions, which are yes and no answers. The app is not interrogating your phone, locking into GPS, looking at your internet search history, etc. It's not doing any of those things. There's been lots of talk in the media about apps that could do contact tracing, apps that might look at density in buildings of people by monitoring where people are. We ourselves have explored all of that. The Pro Density app is absolutely, positively not doing any of that. So daily health screenings, first thing we're doing to beef up public health control, in addition to the masking, distancing, hygiene and ventilation, and the general operating posture of real low density on campus. Second thing we're doing, back to testing. We are launching an epidemiologic surveillance study. This is a research study under the auspices of IRB review and approval. And we will be routinely testing a cohort of undergraduates on campus, undergraduates off campus, graduate students on campus, and staff and faculty on campus throughout the semester. And the reason we're doing this epidemiologic surveillance study is to make sure that the prevalence in our on-campus and immediate off-campus community of affiliates is not higher than we expect it to be based on the prevailing prevalence in Baltimore, in Maryland, and frankly in the country, because we have folk who have returned to Baltimore from elsewhere. So we will be actively monitoring on-campus and immediate off-campus affiliates for the duration of the semester, rather than only going by Baltimore and Maryland numbers collected by others. So that's the second thing we're doing to try to enhance health and safety. The third thing we're doing is to require a flu shot by December for anyone who's coming on campus. Let me talk about this for a minute. You've heard, I'm sure, the term twindemic. So a normal seasonal flu season poses significant health threats. Frankly, everything we're doing to combat COVID also helps in terms of flu. But the one additional thing we can do with flu is get immunized. And it has to be done each year because the circulating strains change. Every year, we offer free flu shots. This year, we will be partnering with a major pharmacy chain to really amp up that program. I'm not going to give you the name of the chain yet because I don't want you going there before all of this is in place. But we will be offering flu shots on campus, and through this program, you can also walk into any location of that pharmacy chain and also get a free flu shot. This program that I'm talking about is over and above the usual health insurance coverage for flu shots. So let me just say a word about that. If you have Johns Hopkins University health insurance, you can already get a flu shot for free, and anyone else on your health insurance can also already get a flu shot for free. And that means at a doctor's office, at a pharmacy, any place you would either get medical care or drug coverage, you can get a flu shot for free. So this program that I'm talking about is an expanded version of the on-campus program and is meant to complement and expand what you can already get covered by health insurance. Now, we're not requiring it until December to give folk time to get vaccinated. But honestly, we of course think everyone should get vaccinated as soon as they possibly can. And we expect this year's seasonal flu vaccination to begin being available in the next 3 to 4 weeks. So let me talk about one final use of testing and how we're going to use it this semester. And that's a bit of mass screening. Now, mass screening is a very complicated topic. You've heard me speak about it previously. At least for the beginning of the semester, the only group who is asymptomatic that we're going to be testing routinely twice a week is our residential students. And this is a reduced set of undergraduates who qualify via a hardship exception to be in our dorms. And we will be testing them because they're in a congregate living situation under our aegis and control.
All right. Thanks, John. You covered a lot of ground, and there were a number of questions that came in. So let me ask a few general questions, then some related to pro density, flu vaccination, and some other issues. So first, there was a question about will the health center be open this fall, the Homewood Health Center?
So both the Homewood and East Baltimore student health centers will be open. However, for obvious reasons, we don't want students just dropping in unannounced. What we're trying to do is handle as much as we can via telehealth. So you have to call first. And the hope and goal is that most health issues can be resolved via telehealth rather than an in-person visit. If an in-person visit becomes necessary, yes, the health centers will be open and a visit will be scheduled.
And it's probably worthwhile pointing out that the JHCCC is not just a hotline, right? You know, this is a organization that's been stood up with medical professionals, right? You know, to help broadly the Johns Hopkins community.
So let me talk about that a little bit. So the Johns Hopkins COVID call center, the JHCCC, is staffed by healthcare providers. It's not staffed by phone operators. It's not like when you call your private physician's after hours service and it's someone who knows how to take a message. You're talking to nurses and physicians. When you call and are screened, it's typically by a nurse. When you're called back, it'll be either a nurse or a physician. There are, as I said, both university and health system personnel in the call center. There are both employee and student focused personnel in the health center.
All right. Actually, we've already mentioned that. Let me go to several questions about pro density. So first one is just when the app is available now. Just you want to talk about when this will be effective and when we're going to start requiring this.
The app is available now. I personally have started using it. We are expecting folk on a go-forward basis now to be using the app for the daily health screen if they expect to be on campus. Feel free to use it if you're not on campus, but it's only a requirement for on campus.
And would it be required, again, reading some of the questions, if I'm just coming in for a few minutes, is it going to be required?
So if you're going to set foot on campus, we'd like you to do both the daily health screen and by December have a flu shot. Frankly, we'd like you to have a flu shot even if you never intend to set foot on campus. Just for your own sake and your family and friends' sake, we want you to have a flu shot. The notion of just coming on campus quickly, we understand there are times when people need to do that. We're trying to minimize that. We want people to come on campus for sort of big deal reasons. You have to teach a course from a studio, you're doing research in a lab, or you're doing research in the library. And so we're actually trying to minimize the notion of folk who in general don't need to be on campus coming in to grab something. We're not outright prohibiting it, but it's not something we're embracing.
Another question just is regarding, again, to whom this applies. So this is an app that is targeted for Johns Hopkins affiliates.
That's right. The app requires that you have a JED ID, and in general, that means your student, staff, or faculty. That's who we're looking to for the app.
Right. So contractors, delivery personnel who don't have JED accounts would not be required to use this.
That's correct.
As well as
Correct.
patients to the medical.
That's right.
Yeah. So a couple of questions came in about those who might have not have a cell phone or might not have an ability to download the app. Do you want to talk a little bit about that?
Yep, sure. So the alternative is the website COVID survey, one word, covidsurvey.jh.edu. You'll log into JED. It'll have the same 2 questions and the same functionality. We will know that you've answered those questions. And then if you're on campus, we'll know that you answered the questions.
Okay, just looking at some of the other questions regarding the app. Can anyone opt out of using it?
If you are on campus, you need to do the daily health screen. If you feel uncomfortable using your mobile device to do it, because you don't believe my emphatic denial of a few minutes ago that we're collecting any other information, just use covidsurvey.jh.edu. There's no requirement that you use the mobile app version.
Right. Okay, great. So a couple questions about going to the flu vaccination, which is also a new requirement for us. Will what we've done previously be continued in that, I know a number of stations around campuses have been set up for employees and their spouses.
Yes, we're going to have an expanded version of that program. In the past, occupational health personnel have staffed that program. This major pharmacy chain is now going to staff that program both on campus and then obviously at all of their many locations around the country. But the program and its look and feel will be the same. If you go through this program on campus, we automatically know you have your flu shot. If you go to one of the pharmacy chains locations and get the shot under this program, they will automatically feed us the data. If you instead use your own pharmacy, your own physician, etc., you can just send us documentation that you had the flu shot, and that'll be just as good. And remember, this is only for folk who need to come on campus, where you have to prove you've had a flu shot. Everything I said about the free program and Hopkins health insurance, and so that absolutely applies whether or not you need to come on campus. But the mandatory requirement for a flu shot is only for those who need to come on campus, and therefore we need to track that you've gotten a flu shot.
Do you want to talk about exemptions?
Sure. So we are following a process that's been in place for multiple years on the health system side, which is an opportunity for both religious and medical exemptions. You will, in the absence of a flu shot, we will take a second look at the masking and other health protective behaviors, but there is the opportunity for an exemption. There's also the opportunity, so if you'd rather get the senior version of the shot and that's not being offered on campus, then of course you can get the senior version of the shot covered by our health insurance. And if you need to come on campus, you would just send us documentation that you got the flu shot. We'd enter it into the system. You'd be all set.
And where would someone find information about where to send that documentation?
So we have not yet released sort of written guidance around the flu program. That's coming shortly, and all of that will be covered.
Yeah, including, you know, I assume many public announcements about where and when
Absolutely.
they can get that.
Yeah.
So a couple of additional questions about testing. In particular, a number of questions about what might be termed testing on demand.
So
do you want to address that?
Yep. So we understand why people would want testing on demand, and Maryland is a testing on demand state generally, but we at Hopkins are not doing testing on demand. So the Johns Hopkins COVID call center determination of whether you get tested or not is based on symptoms and other epidemiologic aspects of your story. And it generally involves symptoms. So if you are asymptomatic, but fear you had some sort of contact, you may be instructed to quarantine, but it's unlikely you'll be tested. As we go through the semester and just see what's happening in terms of prevalence in both symptomatic and asymptomatic persons in our community, we are open to altering that posture. But for right now, we are not doing testing on demand. There are other locations in the city and the state where if you get your private physician to write an order, you can get tested on demand.
And there was a question about the cohort, you know, who's going to be eligible, broadly, what it will cover. Do you want to briefly talk about that?
So this is a research study. Research volunteers will be recruited into the study. There will be a set number of people, so it's not everyone who volunteers will automatically be part of the study. And the basic elements of the study involve twice weekly testing via self-collection, and both nucleic acid and antibodies will be tested. And you know, if you volunteer to be in the study and you're accepted into the study, you'll be expected to do that the entirety of the semester.
Another question that just came in about the flu. If someone doesn't have JHU insurance, but has insurance through their spouse, is there any impact on getting vaccine?
No, so if you are a Johns Hopkins University affiliate, student, staff, or faculty, you can get a free flu shot either by coming on campus, which is not what we're telling everyone, come on campus for your free flu shot. But if you're already on campus, you'll be able to get it on campus. If you don't routinely come to campus, and that's the majority of you, I hope, you will be able to walk into any location of this giant pharmacy chain and get a free flu shot under this expanded program, even if you don't have Hopkins health insurance.
Great. Another question, if someone doesn't have access to a computer at home, right, and also has, inability to download the app, what are their options?
So if that's a person who routinely must be on campus because they're required attendance on campus for their job, then they will need to work that out with their supervisor. And it'll likely be that the first thing they do when they set foot on campus is access an on-campus computer to complete that health screen.
And another question, if someone has their green check mark, how is it verified on campus? How is it used?
So this will vary from campus to campus and quite frankly, vary over time. So we will know via JED who has and hasn't done their daily health screen. And we also know in general who is and isn't expected to be on campus. Because if you think about it, in order to have qualified to be on campus in a research lab, you had to have a plan that identified the people who are going to be in the lab. So people cannot just on their own decide, I'm dropping by campus. And similarly, if you're going to teach from a studio, your school has arranged for that and knows you're supposed to be on campus. And so we know it's supposed to be on campus, and we will be able to verify who did or didn't do their daily health screen just centrally. In addition, you may be asked to show your campus pass on your cell phone. If you say, oh my gosh, I didn't take it by my cell phone, then whoever's asking will be able to look you up in the system and see if you took it.
And there was a prescient question about, when we get a COVID vaccine, right? Will that be mandated? Do you want to opine on thoughts related to that?
That question is way more complicated than it might seem on the surface. And it's complicated because it's more likely than not, it'll be vaccines, plural, rather than one vaccine. It's complicated because of the risk-benefit profile of a given vaccine to a given person with vulnerabilities, either pre-existing health conditions or age or something else. We anticipate that different vaccines are going to have different risk profiles as well as different benefit profiles for different categories of people from a health and age perspective. But if our H1N1 2009 experience is anything to go by, we will be making the vaccine available as rapidly as we can by pooling resources across the university and health system and prioritizing affiliates who would get the vaccine based on health risk.
And we all hope for that day to be soon, but recognize it is likely in the future. Thanks, John. There were a couple of additional questions that came in particular, Andrew and Heidi, that I thought might be useful for you to address. Andrew, one question came up about tenure and promotion decisions. Many faculty are struggling with, continuing to support, their home life, and as school starts in the fall, have expressed concerns with how to balance those responsibilities with, continued research and productivity. Do you want to talk a little bit about, the discussions that have come up about this as applied to faculty? I mean, it certainly applies broadly to everyone, but the question was about faculty.
Right, Stephen, so let me talk about this specifically and then broadly. Specifically, the university has extended everyone who has a tenure clock by 1 year. We really know that that's insufficient. So if you as a faculty member joined post the date on which that decision was made by the Board of Trustees, you are governed by the old criteria, and that needs to be changed. We also understand that the scholarship of some faculty members is going to be radically altered by the ability to travel, inability to travel, and inability to do various things. That discussion is now taking place, and it really is for the senior faculty to look at their individual school and make the adjustments in the individual school, because it is the senior faculty who really set the standards in the school. So for example, if you take the Homewood schools, it is the Homewood Academic Council that needs to change its rules and make sure that it accommodates what's going on and really locks this in for a period of time which is meaningful for the faculty. So they need to think about what letters to write to the referees, what the standard procedures are, and the Board of Trustees essentially will work to ratify the changes that take place. They've already done what we've suggested, which is move everyone who was in place to an extra year, but there will be more adjustments coming.
Great. Thank you, Andrew. That sets up, well for, anticipating more in the future. And in a similar way, there was one other question that came in through the course of the town hall, Heidi, about, I think people are starting to use the resources that you've announced and put out. But, some of them are just, trying to find out how to meet their needs. And things in care.com may just be limited. Do you want to talk about, again, what may be coming down the pipe?
Sure, Stephen, I'm happy to. And I do think that we have identified, access to caregivers as a significant issue. The supply right now is very low. And so we have heard from some that care.com, they may not be able to find a caregiver on care.com. We have Maryland Family Network. We have other resources available. I mentioned Comet. I would urge you to call the Benefit Service Center or also to go to our website. And what I will say is there are some problems we're just not going to be able to solve. We focused on a number of different resources to help families. What will be announced next week is really a caregiving support fund. So it's focused on cost, and then it's also focused on educational resources like tutoring partnerships, not necessarily kind of caregiving. I would mention one last thing. We know that the Y of Maryland also has set up kind of caregiving support on their Y campuses for school-age children. So that is also an opportunity, and one of the reasons that we focused on the additional financial support to help families. It might be an opportunity there, but there are some challenges that are going to be harder than others.
All right, thank you. So to the panel, thank you very much. To everyone who participated, thank all of you for your ongoing understanding and support of Johns Hopkins. With the release of our return to campus guidance, our central efforts really are now turning to helping faculty, staff, and students at each of the schools launch and sustain a successful fall term. We will continue to assess the situation in addition to our outlook for spring, evaluate and modify our approaches as needed, and keep you informed. While I know that we weren't able to answer every question, I hope this session has been able to provide further clarity about the extensive planning around our return to campus. Additional comments and feedback can always be given through the covidinfo.jhu.edu website. This session was recorded and an archive will be provided on the web, as is the other town halls. Until next time, please remember to keep adhering to good public health measures, wash your hands often, avoid close contact to maintain physical distancing in public spaces, and keep wearing a face covering when in public. Keep safe, and we look forward to talking